Dyspnea. Acute dyspnea is a common clinical finding in the emergency department and other urgent care locations. Colitis. I went to the doctor because I was having severe stomach pain in the upper right quadrant, and they said I have colitis. Choriocarcinoma. During her pregnancy, she found out she had choriocarcinoma. Epistaxis. I had to stop my run today because I started to suffer from epistaxis and get a tissue to stop it. Esotropia. My teammate suffered from esotropia, so they had to wear glasses. Diaphoresis. As the body temperature falls, profound diaphoresis begins. Orchiotomy. The male patient had to receive an orchiotomy because of cancer in his testicle. Ischemia. If the blood flow to your small intestine or colon is reduced, you may develop intestinal ischemia. Pneumocentesis. Blood started to fill the lungs, so pneumocentesis had to be performed. Hyperesthesia. I suffered from hyperesthesia and could not use certain lotions. Narcolepsy. My roommate suffers from narcolepsy and has to take medication to help her stay awake. Bradykinesia. Motor symptoms include tremor, rigidity, and bradykinesia are the most common presenting symptoms. Meningocele. Meningocele is a birth defect that occurs in early stages of pregnancy. Gingivectomy. The gingivectomy created the patient to have better eating function and less cavities. Colopathy. Patient suffered from a mild case of colopathy. Rectocele. Using a patch to repair moderate and serious rectocele by incision via vagina. Pancreatoma. After a patient went through excessive chemotherapy, they still had a pancreatoma, so the doctor had to up the dose. Dysphagia. I had been struggling with dysphagia for a few weeks, causing me to lose weight because of it. Retroperitoneal. Bleeding may occur at any site and be difficult to detect, for example, retroperitoneal bleeding. Hemophilia. Objective to observe the influence of age on early rehabilitation of acute stroke patients with hemophilia. Osteotomy. The patient was advised of the risk of makeshift tibial osteotomy and lengthening, and she declined surgery. Hemolysis. However, if hemolysis occurs during blood drawing, falsely elevated plasma magnesium levels may be obtained. Arteriosclerosis. Most aortic aneurysms occur in the abdominal aorta, the main cause being arteriosclerosis. Hemostasis. It took me 2 whole minutes to return the hemostasis. Rhinorrhea. The results in rhinorrhea, itchiness and dysphagia, and anaphylaxis. Cardiomyopathy. Cardiomegaly. Final answer. Mild cardiomegaly is common in athletes. Tracheostomy. Previously, a tracheostomy was necessary with positive pressure ventilators with the implication of invasive procedure. Arthroplasty. Hip and knee arthroplasty is increasingly important to improve the quality of life for adults in arthritis. Arteriostenosis. Conclusions of CRP and concentration is a useful clinical index for evaluating the degree of coronary arteriostenosis.